Hi there everyone, this is Backshinder from Healand Clinic. So today we're going to talk about treating vascular occlusion. The treatment for vascular occlusion during an aesthetic procedure depends on the severity and the location of the occlusion. In general, the goal is to restore blood flow to the affected area as soon as possible to minimise tissue damage and to prevent further complications. One common type of treatment for vascular occlusion is to inject a medication called hydrolase, which is a dissolver for filler material, and to restore blood flow to the affected area. This should be done as soon as possible after an occlusion is detected. In more severe cases, however, other treatments may be needed to manage the symptoms to prevent further damage. This may include medication to improve blood flow, oxygen therapy, surgery in more extreme cases. It's important to seek medical attention right away if you suspect a vascular occlusion during an aesthetic procedure. Early intervention can make significant differences in the outcome of the help and prevention of long-term damage or complications. To minimise the risk of a vascular occlusion during an aesthetic procedure, it's important to choose a qualified medical professional who has the experience in performing the procedure and understands the anatomy of the area being treated. They should also use appropriate injection techniques and carefully monitor you for any signs for further complications. If you are interested in or considering having dermal filler treatment, please visit our website at healand.co.uk or click on the link below to book your initial appointment. Thank you, that's it from me for this one. If you enjoyed this video, please hit a like and subscribe. Also, so that you don't miss out on any of our uploads on exciting new treatments that we have in offer, click on the bell notification and I will see you very soon. Bye for now.
Let Healand be part of your healthcare journey.